All right. Hello, everybody. I'm Melissa. I'm going to talk to you about heart failure. So heart failure is when the heart doesn't pump blood efficiently throughout your entire body. So some signs and symptoms that we look for in the hospital when the patients come in: shortness of breath, they get fatigued easily, they're edematous, you see it in their arms, their legs, they have an increased heart rate, increased blood pressure, they have a cough, and our most sensitive indicator for heart failure is weight gain. So in the hospital, there's a few things that we look for each day, and one of those big things is daily weight. We put these signs over the beds of our patients who have a history of heart failure in the hospital for heart failure, because what we're looking to see is, are they adequately getting diuresed? Are those medications working to get that fluid off of them so they can breathe easier, so the blood is getting to the parts of the body that need it most? So some other things we look for, we measure their output as well. So, we look for how much they're going to the bathroom. We look at how much their intake is. Some of these patients will be on a fluid restriction. So this way we know how much they're taking in. So we know they're not putting their body into that fluid overload. We monitor their vital signs. We take their blood pressure before they get up, because we know that these patients are also on diuretic medication, which lowers the blood pressure, and usually they're on medication to help control their blood pressure and heart rate as well. So we don't want their blood pressure, them to stand up and then drop to the floor because their blood pressure goes too low. We also put these patients usually on a sodium restriction or a cardiac diet. So this way they're not taking in all that extra sodium to hold on to that fluid as well. Some diagnostic tests that we do are chest x-rays, echocardiograms, EKGs, stress tests, CAT scans, because we just want to see how that function of the heart is. We want to see how well their output is and how we can make it better. So there are 4 classes of heart failure, ranging from no symptoms, and then stage 2 is mild symptoms that resolve easily at rest. Stage 3, they have some moderate symptoms that take a bit longer to resolve. And stage 4, they have severe symptoms that don't always resolve with rest. Readmission rate is actually pretty high for CHF patients, because they feel when they're discharged from the hospital, they feel better. So they can just go back to the way they were living before they had the heart failure problems in the hospital. So our biggest thing with heart failure is education. We have to educate the patients to change their diet, to lower the sodium, to watch how much they're putting into their body. We have to teach them about medication safety. We have to teach them to monitor their blood pressure. This way, patients have that white coat syndrome where they go to the doctor, their blood pressure is high, so the doctor says, oh, we need to keep that medication going. But they're also on that diuretic medication, and when they're home, they're more relaxed. And we could be bottoming out their blood pressure where they're dizzy all day. So we have to teach them about those safeties. We have to teach them to follow up with the doctor, that these problems aren't just going to go away, that they have to make sure that they're being safe. Teach them to weigh themselves at home as well. And then one of the bigger things is teaching them to wrap their legs, either with the ACE wraps or put on those TED stockings, which are not the easiest things to put on, but it'll help keep that fluid from pooling in their legs so they can be more active, so that blood can get to their feet as well. Do we have any questions? Thank you.
Thank you.